Good evening, everyone. Welcome to our medical talk tonight. Our topic tonight is hair transplantation, and I'm super happy to welcome Dr. Karoutis. He works for, or he's the owner and co-owner of the Swiss Luxury Clinic here in Switzerland, and they focus on discrete aesthetic surgery and very much specialized in hair transplantation. So welcome, Dr. Karoutis, and thank you for joining.
Thank you so much for having me in your podcast.
So the big question that we really always hear when people ask us about hair transplantation is, how does it work? How do you do hair transplantation? And we would be very happy if you could share a little bit of what you actually do.
Okay. Well, I'm pretty sure this is the most common question also you find online. Unfortunately, this type of sector is highly commercialized. The very simple basis of hair transplantation is basically we take tissue from one area of the body and we move it into another area of the body. So in this case, we take grafts that carry the hair follicle from the donor site in the back, and then we reconstruct an area surgically that lacks these hair follicles. So this is the very general aspect of how it works. Unfortunately, currently there is a bit of misinformation of how it's working because everyone is focusing so much on the surgery. So on one side, we have the surgery where it is heavily commercialized, and currently you don't find a lot of doctor expertise in this, but no one is doing also the therapies. So what you have is basically constant surgery after surgery after surgery without really having a result you're happy with. So people are just locked up in these loops. In general, the surgical aspect is quite simple. What changes is, of course, the artistry of the doctor who does it and the precision rates and basically the cuts. The cut in surgery is the most important thing. And if you were to really study it down, you can basically improve a lot of things. There's recovery times and, of course, results as well.
So how do you distinguish between, let's say, a highly skilled surgeon who can do the hair transplantation and, let's say, a not so experienced? Is there any hint that you can give here?
Yeah, basically the main aspect, the problem currently is not so much about the doctors. The doctors who we are working in this, we are known, specifically in Switzerland, since it's quite a small country. The problem is that these hair transplants are currently not done by doctors. So while you might meet a doctor, as here, most commonly, it's actually around the 90% of cases, especially in commercial centers, a doctor does not do the operation for you.
So who does that?
It is actually a technician. So it is a technician branded as specialist doing a course over the weekend, and suddenly they have medical knowledge. Of course, this is not legal, but this is how you can find these very low-cost surgeries. Of course, trusting an individual with no medical background and surgical training to take a scalpel and remove tissue, which is a permanent removal, and then place it somewhere else, leads us to these quite extreme examples we see also online nowadays. So my first advice as a doctor specifically for this is always ask who will be doing my operation. This should be the compass to locking in as much safety as you can. Because again, in surgery, what we can guarantee is the execution and the hypothesis. The results come in probabilities, which are heavily dependent on the process that we do. That's why we go through such training.
The second big question, and you were kind of touching this in your last sentence already, is success rates. So we have been, I think a lot of people, they get their information online, they see all this, radical failures. They are kind of, okay, I would like to have a hair transplantation, but I want to make sure the success rate is really good on me. Is there any number that you can provide, let's say, between highly skilled doctors and, let's say, technicians, or how would you tackle this issue of success rate?
So, of course, the research that we have for the success rates only comes from the research that is provided from doctors and medical work. So this is how it's being graded, and then we get to the numbers. Usually for surgical, like pure medical, so doctors doing the exact operation, you get around 90% success rates. Of course, this success rate only involves the hair follicle growing into the area we transplanted it. Some things that are also interesting to look into is the damage that it leaves in the donor site, so the area which we extracted in, and what is sort of the amount of operations you can have throughout your lifetime. I would say when you go with the doctor in this, because this is the research that we have from the boards, the success rate is around 90%. Now, the only way these operations can go wrong is if, of course, the hypothesis is wrong, so we make a completely wrong estimation, or if the execution is not correct. So usually in the execution phase, because it's a surgery, if we have a discrepancy in infections, if we have a discrepancy in the amount of tissue we extract, then we have side effects that will not get us to this 90% probability of success. So this is sort of a rough way to identify your way around this.
My last question, because we don't want these interviews to be too long, but you mentioned something that I wasn't even aware of. You mentioned the amount of possible hair transplantations that you can have in your life. Now, I would just be interested, how often can one do this?
So basically, currently, the information that is available online, which is non-medical, states 3 times for your entire lifetime. Of course, this is not based on a correct medical protocol. It's if we were to extract maximally with sort of these surgical techniques that currently exist. What we do specifically is we perform a cut that is a lot less invasive. So the trauma that it leaves behind is able to recover much faster. And if we're not 100% precise, the follicle will grow back from the area that we left it. This, of course, increases the amount of time that you can have these operations in your lifetime, but our approach is a lot safer. So instead of going with the famous graft count, where you count the amount of follicles that go in, we go for reconstruction cases. The reason why we do that is because we saw that the graft count model, so the counting of the hairs, usually is related with technical work and some shock loss effect, which is a negative side effect you have when you focus only on extracting as much tissue as you can. So the body goes into a shock and you end up losing some of your own hair. We don't do that. So this is why we are able, along with some other surgeons that we work with, to achieve a higher amount of these operations throughout one's lifetime.
3, 4, 5, 6?
Yeah, usually it's whenever you go, when the approach is commercial, so you're looking for numbers, usually you get bad results, or how we call it, the Pamela Anderson effect. Something that is a clear distinction of you have had surgery. And we don't do that. So basically the number is above 3, usually over 6 times, but every approach is specific so that it is a discrete result. That's the basis of a surgery. You want it to be a silent surgery, not something that people can point to and make a laugh of.
Dr. Karoutis, thank you for the insights. It's been very interesting talking to you. And
thank you so much.
All the best. Thank you so much.
Thank you so much. Thank you. Have a great day.
You too. Bye-bye.